Are you tired of hearing all the conflicting and often confusing information about how to properly care for your precious little one? Are you constantly second-guessing yourself as a new parent and feeling overwhelmed with all the different advice out there? If so, you're not alone. In today's video, we're going to be debunking the most common baby care myths to help you navigate the early days of parenting with confidence and ease. So grab a cup of coffee and let's get started. If you're looking for reliable and evidence-based information about baby care, then make sure to subscribe to the Yardy Baby channel. We provide daily tips and debunk common myths about caring for your little one. Hi there and welcome to Yardy Baby. As new parents, it's natural to have a lot of questions and concerns about how to best care for your baby. From feeding and sleeping to hygiene and development, there is no shortage of advice out there. But with so many conflicting opinions, it can be hard to know what is true and what is just a myth. That's why in today's video, we're going to be debunking the most common baby care myths. Some of the myths we'll be tackling include: Myth 1. Babies need to sleep on their backs to reduce the risk of SIDS. This is actually a very important myth to debunk, as SIDS, sudden infant death syndrome, is a major concern for many parents. It's true that placing a baby on their back to sleep is one of the most effective ways to reduce the risk of SIDS. In fact, the American Academy of Pediatrics recommends that infants be placed on their backs to sleep for all naps and at night. This position has been shown to reduce the risk of SIDS by as much as 50%. However, it's important to note that this recommendation is not absolute. If a baby has difficulty breathing when placed on their back, or if they have a medical condition that requires them to sleep in a different position, it's important to follow the advice of a healthcare provider. Myth 2. You shouldn't wake a sleeping baby. This myth is often perpetuated by well-meaning friends and family members who believe that a sleeping baby is a happy baby. And while it's true that sleep is important for a baby's development and well-being, there are certain situations where it's necessary to wake a sleeping baby. For example, if a baby is overdue for a feeding or diaper change, it's important to wake them in order to meet their basic needs. It's also important to wake a baby if they have been sleeping for an extended period of time and you're concerned about their safety. For example, if a baby is sleeping in a car seat or on a soft surface, it's a good idea to wake them every hour or so to make sure they are safe and comfortable. Myth 3. Babies should be on a strict feeding schedule. This myth is often based on the idea that it's important to establish a routine for a baby as early as possible. While it's true that routines can be helpful for both babies and parents, it's important to remember that babies have their own unique feeding patterns and needs. It's generally recommended that infants be fed on demand rather than on a strict schedule. This means that a baby should be fed whenever they show signs of hunger, such as rooting or fussing. It's also important to pay attention to a baby's individual needs and to adjust feedings accordingly. For example, a baby who is going through a growth spurt may need to be fed more frequently, while a baby who is experiencing digestive issues may need to be fed less often. Myth 4. You shouldn't let your baby cry it out. This myth is often based on the idea that it's cruel to let a baby cry without offering comfort. However, it's important to understand that crying is a natural and necessary part of a baby's development and is a way for them to communicate their needs. In fact, it's completely normal for babies to cry, and it's important for parents to respond to their cries in a timely and appropriate manner. That being said, it's also important to recognize that there are different approaches to managing crying, and that what works for one baby may not work for another. Some parents find that letting a baby cry it out can be an effective way to teach a baby to self-soothe and establish healthy sleep habits. However, it's important to keep in mind that this approach may not be suitable for all babies and should be used with caution. It's also important to note that crying it out should not be used as a blanket term to describe all methods of letting a baby cry without immediately offering comfort. There are many different approaches to managing crying, and it's important to find what works best for both you and your baby. Myth 5. You shouldn't pick up a baby every time they cry. This myth is often based on the idea that picking up a baby every time they cry will create spoiled or dependent babies. However, this is simply not true. In fact, responding to a baby's cries in a timely and appropriate manner is an important part of establishing a healthy attachment and helping a baby feel secure and loved. It's important to recognize that there are different types of cries and that each one requires a different response. For example, a baby who is hungry or in need of a diaper change should be promptly attended to, while a baby who is simply looking for attention may be comforted with a hug or a soothing voice. It's also important to remember that babies have different personalities and needs, and what works for one baby may not work for another. It's important to pay attention to your baby's individual cues and to respond accordingly. By the end of this video, we hope that you have a better understanding of the most common baby care myths and how to properly care for your little one. Remember, it's important to seek out reliable and evidence-based information when it comes to caring for your baby and to trust your instincts as a parent. Don't be afraid to ask for help or to consult with a health care provider if you have any concerns. Thanks for watching. Don't forget to like and subscribe for more baby-related tips and information.